Let me give you a brief introduction to naturopathic medicine. What is a naturopathic doctor? An ND concentrates on whole patient wellness, attempting to find the underlying cause of the patient's condition rather than focusing on symptomatic treatment. Naturopathic doctors utilize natural therapies rather than synthetic drugs. Naturopathic doctors practice the 6 fundamental principles of naturopathic medicine. First, do no harm. The healing power of nature. Find the cause. Doctor as teacher. Treat the whole person. And preventative medicine. During this webinar, you will be hearing from Dr. Christine Gerard, Vice President of Academic and Clinical Affairs here at Southwest College of Naturopathic Medicine. Dr. Girard completed her undergraduate degree at Goddard College in Plainfield, Vermont, and received her doctorate of naturopathic medicine from National College of Naturopathic Medicine in Portland, Oregon. She participated in and completed the first hospital-based residency for naturopathic physicians at Griffin Hospital in Derby, Connecticut. Dr. Girard's career has focused on hospital-based integrative medicine and leadership in undergraduate and postgraduate naturopathic medical education. So once again, thank you for attending our webinar. We hope you find this presentation both interesting and informative. And with that, let me introduce our presenter, Dr. Christine Gerard.
Well, good morning, everyone. I will bring our presentation up here. And I want to welcome you to SCNM, and I want to share with you today information about our curriculum, what makes it so unique, and in doing so I'll also be sharing with you the inclusive culture at SCNM, where we really focus on listening to our students and wanting to make sure that we take their feedback very much into what we do on a daily basis. So, as you know, we have in fact revised our curriculum, and I'm just looking to see why my slides are not changing. Excuse me, there we go. And as many of you may have heard, our curriculum revision was from the ground up, which means it was a very extensive curriculum revision. It was faculty driven, there was a very inclusive process, and it was very student-centered. Many people ask, why did you revise the curriculum? What was wrong with it? Well, frankly, there was nothing wrong with the curriculum necessarily, but we did find that there were areas where we could improve the curriculum. That's very important to us because ultimately we want to make sure that whatever we do to provide training to you as a student allows you to progress through your medical education so you become competent and confident naturopathic physicians. So as I mentioned just a moment ago, we received feedback from faculty and students in terms of how we might be able to improve the curriculum. We follow a continuous improvement loop here at the college, so we always try to learn and make better any of our processes, and that includes the curriculum. What we heard from faculty and students is that they believed that things might be sequenced better, that there was some redundancy within the curriculum. Now in curriculum there is both unnecessary redundancy, those things that really do not help students gain knowledge or progress in their knowledge, and then there is necessary redundancy, which is very important for the adult learner to be able to really grasp information. So in our curriculum revision process we made sure that we retained the necessary redundancy and we let go of those things that were unnecessary. We also heard from students that they wanted more naturopathic philosophy within the early years of the curriculum, and they also wanted more access to clinical training. What we heard from them was, we're here in medical school because we feel called to to touch patients, to help people, to heal people. And when we go through this very intense basic science component of the curriculum, it's hard to maintain our inspiration. It's hard to remember why we are here. And so if you can help us by providing us that inspiration, it will help us be more successful through the basic science courses. And so that's exactly what we did. We incorporated clinical experiences into the first years of the curriculum. In fact, students receive their medical equipment during orientation, and they use the medical equipment from day one. We incorporated a new class called Clinical Practice. This class has a lab component in it also, and it's within these classes that students begin to practice utilizing their medical equipment on each other to begin with, and then eventually learning to use this equipment on standardized patients. They also begin to do various components of physical examinations, and they begin to really work on attributes that are difficult to train. So attributes such as how to communicate clearly with a patient, how to deal with difficult patients, how body language really makes a difference when you're talking with a patient or spending time with a patient, medical ethics and those sorts of issues, along with legal and statutory issues that are necessary for students to understand as they begin to practice under the direct supervision of the attending physician. All of this training within the clinical practice class and lab culminates at the end of the first year in the summer term in the field observation program. And this is a program where students go out into the field and they shadow physicians who are in private practice. As they are shadowing those physicians, they not only have the ability or opportunity to shadow the physician as the physician is seeing patients or as a medical procedure may be done, they also have the opportunity to shadow the physician's staff members who perhaps are working in a lab or who are answering the phones and doing the patient check-in, answering questions of patients. So they begin to learn the business aspect of things. The college takes the business training for students very seriously. So as much as we know we need to train you in medicine, we also know that from a profession standpoint, the majority of our students upon graduation go into private practice, and that requires of them business knowledge as much as it requires of them medical knowledge. And so the field observation program allows students to begin this exploration. In addition to that opportunity, students at our own medical center have the opportunity to learn how to work within our own lab, learn CLIA-waived testing that they may use in their private practice through participating in a lab post, and then also participating in a medicinary post, which gives them the opportunity to learn about ordering product, inventory management, those sorts of things, so that if the student upon graduation decides to have a medicinary in his or her private practice, then there is that training. There's also training within the curriculum itself in terms of business courses, but that's a topic for another day. As I mentioned, students are utilizing standardized patients, and one of the really important pieces of standardized patients, why we incorporated the use of standardized patients in the revised curriculum, is that standardized patients actually have training so that as they quote-unquote present with a particular symptom picture, that is done in a way that is very consistent and standardized, so that one student to the next can have a consistent experience within the clinical training opportunity there. And also standardized patients are trained to give immediate feedback to students. And we know in higher ed that adult learners need immediate feedback to be able to really understand and grasp the information that's necessary, and then also the attributes in terms of how they are working with those patients. Throughout these first 2 years, we also begin to utilize an assessment called the clinical milestone exams. And so students are prepared to successfully complete their clinic entry exam. And then they also have a primary status exam and then a clinic exit exam. And these are assessments, clinical assessments that we use throughout the curriculum to make sure that you understand where you are within the curriculum, within understanding the medical knowledge, and that you know that you are being successful as you're going through that process. The progression of medical information and education goes into the 3rd and 4th years in the clinical experiences, where students have the opportunity to see patients one-on-one under the direct supervision of the attending physician at our medical center and also at our 9 community clinics. Within this context, students have a lot of flexibility in terms of the types of experiences that they can have. We also have more and more clinical responsibility, as you would expect, as students progress into their 4th and final year of medical education. As I mentioned earlier, students had talked to us about wanting to have more history and philosophy of naturopathic medicine incorporated into the beginning of the curriculum. And we created a first-year course that's a year-long course. This course was actually created by students, and they came to a curriculum committee meeting with this course and talked with us about the components of this course as they thought would be very important. We took that and the faculty modified it with additional student input, and that's how this course was created and implemented within the revised curriculum. This philosophy of naturopathic medicine is woven throughout the entire program and culminates in a project in the 4th year of the program. Everything that we're doing at the beginning of the curriculum, especially in those basic sciences, is organized by body systems and also by cases, as students gave us feedback that it was very important to them that there be all of the information hung on cases, for as a lack of a better way of saying it, so that it became more relevant. So students are now better able to utilize information in their clinical years that they learned at the very beginning of the program, because it was all organized around cases. All of the testing and examinations that we do within those early years are based on the format of the NCLEX examination, which are our board examinations. We believe that by offering you many opportunities to test utilizing an NCLEX-like format, that reduces anxiety for students as they go into their board exams and actually makes them more familiar with that type of testing so that they can be successful as they take their board examinations. All of this alignment and sequencing of content really helps students progress through their medical education. The progression ends up feeling somewhat intuitive and very logical. So it's a very smooth transition as students are going from year to year. We have incorporated a lot of faculty development within this revised curriculum. We felt it was very important for faculty members to be supported to utilize new ways of teaching so that, again, we can support student success as they go through the curriculum. And some of the things that we've done is we've incorporated team-based learning within our entire curriculum, not just in the didactic component of the curriculum, but also when students get into clinicals. And for those of you who are not familiar, team-based learning is a way of approaching information that really encourages students to think independently and to work in groups. That may seem a little odd, kind of juxtaposed there, but essentially there are assignments that students are required to complete independently outside of class, and then they come to class prepared and they take an individual assessment. The term for that is an IRAT, and then they get together in small groups and do a group assessment called a GRAT. And those two assessments are utilized by the professor to make sure that students are understanding the concepts within the course itself, and all of those assessments become part of the grade for the student along with any other testing or projects that may happen. In addition to team-based learning, which I should mention is utilized at a number of very prestigious medical schools such as Tulane, University of Michigan, and others. We're the first naturopathic medical school to incorporate this type of teaching within our curriculum. In addition to the team-based learning, as I was saying, we also incorporated the use of an audience response system. Many of you probably know this as the clicker. And the clickers are very important for us because, again, professors can utilize those, utilize this technique to make sure that the class is following the content. In addition, it offers those students who perhaps are not as outgoing as others to participate without feeling like he or she is on the spot. And so these sorts of technologies are very important to us as we continue to kind of push the envelope and incorporate new types of teaching, pedagogy within our classroom. The other thing I should mention to you about our revised curriculum is that we've really optimized the number of hours that students are sitting in a classroom. One of the things students said to us is, gosh, I really want to be doing stuff. I learn better by doing things as opposed to just sitting there listening to PowerPoint. And so because of that comment, we incorporated the types of teaching methodologies that I've just mentioned, and we've also incorporated more lab hours and more clinical hours for students so that they're able to do as well as just listen. In addition, there's more time for reflection and what we would call the internalization of the content. Students also have more choice in that we have electives and what I'll call selectives. In our revised curriculum, there are a certain number of credits where students may select from a list various coursework. This allows them to explore some information perhaps that they're interested in, and it allows those students who are very clear on their path to have what I might call a concentration. If we consider naturopathic medicine the major, for those of you remembering undergrad, and that the classes and the selectives perhaps are the minor. So if a student wanted to quote-unquote minor in pediatrics or in mind-body medicine or in homeopathy or other things, those sorts of courses are available through the selective track. This is very important from a student standpoint, as you I'm sure are aware, because the more opportunity you have to choose, the more engaged you are within your education itself. And so you can see here on this slide that we have an alignment of our curriculum from year to year. And this alignment ends up being very, very important because that's what allows you to progress through your medical education in a way that just feels right. It has that logic to it. The other thing I should mention is that the college takes this alignment concept very seriously, to the extent that this alignment also goes to our strategic plan to make sure that all of our budgeting processes support our core mission, which is this curriculum to support your success through the curriculum, and even to the board level. Our board of trustees has goals and outcomes that are their guiding principles. All of this is aligned up to that level of the organization. The college has done a lot of work over the last number of years, as you can imagine, through this curriculum revision, but also to ensure the alignment. And again, the alignment allows you to progress through your medical education, but it also allows every employee and faculty member at the college to understand what their direction is as well. And so it makes for a very contiguous community that I think is very important as we, again, really work to provide you the experience so that you can be a successful naturopathic physician upon graduation. So that concludes my, my comments at this point. Jane, if you have anything that you would like to add, I'd be happy to have you do that at this time.
No specific comments. Thank you, Dr. Girard. Just a couple of questions on the board.
Certainly, I'd be happy to entertain questions.
All right, appreciate that. And when you're ready to pass that back, we can do that to the presenter. So the first question I've got on the board is this new curriculum harder than our previous? Excuse me.
No, I can't say that the curriculum is harder necessarily. I think that any medical school, regardless of the type, whether it's allopathic, osteopathic, or naturopathic, is going to be a challenging experience. There's a whole lot of information. Students from any of those professions will talk about medical school using the analogy of it was like drinking from a fire hose. So I'm not trying to scare anyone, I'm just trying to be realistic. That being said, I think that the revised curriculum, as challenging as it may be, actually provides a more intuitive progression of medical education because of the sequencing, because of the new types of teaching methodologies that we're utilizing.
Thank you for that. Thank you. Can you tell us what types of patients our students are seeing, not only here at SCNM, but you mentioned several off-site clinics?
Sure. At our own medical center, let me start there. We are seeing over 15,000 patients per year. Approximately 80%, 75 to 80% of those patients are return patients. Now, the reason I tell you this is that from a student standpoint, that ends up being very important because having patients come back ends up allowing you to provide longitudinal care. And that's one of the hardest things for any medical school or clinic to offer you as you're going through training. You get a chance through longitudinal care to learn how to manage a patient, to see what's working or not working. And that assessment, the ongoing assessment, is crucial as you're learning how to do outpatient medicine. So that statistic is very important. We have a number of therapeutics that are utilized in our medical center. I should tell you that we have 40 plus clinicians. We have naturopathic physicians, chiropractic physicians, allopathic physicians. We have neurofeedback specialists. That's a type of, for lack of a better way of saying it, biofeedback. We have acupuncturists, oriental medicine doctors. The types of therapeutics that we use are hydrotherapy. We do quite a bit with injection therapies, including IV therapy and prolotherapy. That's something that we've begun to see quite an increase in. Arizona has a very wide scope of practice, so it gives students quite the opportunity to explore all of the therapeutic modalities, including minor surgery, the IVs and injection therapies, as I've mentioned, and also the use of pharmacotherapy. That's not to say it's the first thing that we do. Most often, we go and start working with nutrition and diet and lifestyle changes, and then we progress from there. We always start with the minimally invasive therapy first and then progress as is necessary as we're working with a patient. In our extended site clinics, we provide care, I should say, to what we would consider to be underserved patient populations or folks who would normally not receive any medical care whatsoever. Our focus is on free medical care in those settings. We have at this point 2 community clinics in elementary schools. We have a third coming on board this fall. So we have quite a presence within the Phoenix school districts. We also have 2 clinics at Sojourner Center, which is the country's largest domestic violence shelter. We provide care to the women and children who are in shelter there, along with the women and children who are in long-term programming there. We have a few clinics that focus on providing care to those folks who have what we would call dual diagnosis. That would be mental illness and addiction issues. And so that begins to round things out. We also have a clinic at an HIV/AIDS center, and they do quite a bit of research there as well. So there's a broad spectrum of patients and opportunities to touch many different types of patients within the clinical training here at the college.
Speaking to those types of patients, what can a naturopath treat?
Do you mean in terms of diagnoses? Well, pretty much everything across the board that you would consider in outpatient medicine. And so we have certainly we work with patients who are diabetic, who have heart disease, who have asthma, COPD, digestive issues, any of the GI stuff, pain syndromes, metabolic diseases and immune disorders, dermatologic issues, especially here in Arizona. You can imagine there's quite a bit of derm that people see. Headaches, migraines. We do quite a bit with preventive medicine, so not just screening, diagnostic screening and that type of thing, or I'm sorry, screening exams, but also in terms of prevention and even wellness. We'll work quite a bit with patients in that regard. We do see cancer patients. Typically, we are not the primary for those cancer patients. We're typically working with other medical professionals, such as medical oncologists, surgical oncologists, and that type of thing. I hope that answers the question.
That's the direction I was going. Thank you very much for that. Can you tell us a little more about the standardized patients? Are they students or faculty members?
No, that's a great question. They're not. I will say that at the very beginning of the training, as students in their first year are just starting to learn to use their equipment, they will practice on each other. But once we start getting into more of the training around the exams that students will need to learn for their patient care, we begin utilizing standardized patients. And so those are what I suppose we would call members of the public, although they have very special training to be able to have that designation or credential to be a standardized patient. So they have training in what certain diseases present as. So that way, as they are presenting as a patient with whatever cluster of symptoms, they're able to communicate that and if you will, act it out. Some of our standardized patients are actors. Others are students from other colleges in the area who are in theater training and other things like that. Some of our standardized patients are retired folks who go through this training process and feel very strongly about participating in medical education. Some of them speak very passionately to me about their commitment to help train the next generation of physicians. For them, it's almost like a community service type opportunity. We do not have faculty members who are standardized patients, at least our faculty members. It's very important, in our opinion, to have a separation there so that faculty members who may be grading students on an exam or another type of an assessment, that there's that degree of separation there. Students would receive feedback from their faculty member and also from the standardized patient as is appropriate.
All right. I've got two that I want to kind of put together. One is they're both very broad, actually. Do you think in the future there will be more states that allow naturopathic physicians to practice? And what do the trends show us for naturopathic medicine?
So let me start with the number of states that license naturopathic physicians. I do believe that we will have more and more states that license naturopathic physicians. The naturopathic medicine profession is one that provides sponsors is the better word, what we call a federal legislative initiative on an annual basis. So every year, and actually I'll be doing this in 2 weeks, naturopathic physicians and naturopathic medical students descend upon Washington, D.C. and go visit legislators from their home states or from the states where the colleges are. And what this does, it allows us to provide education to those legislators who will be participating in the lawmaking decisions. Every year, the profession has an agenda with which it communicates to these legislators. In addition to this initiative, every year various states go through their own process, the individual state process, to gain licensure. And we've had a number of states that have very, very active legislative efforts with varying degrees of success. It takes a while for these laws to go into effect simply because there's such an education process, and it also depends on where the legislature itself is within the election process. And so this year alone, we have had efforts in more than half a dozen states. We now have 16 states that are licensed. We'll learn in a little bit, probably by the end of May, where we are in terms of if we've had additional states licensed within the U.S. So I do believe with all of the efforts that are taking place that we will have more states licensed. I will also say that patients are very powerful in these sorts of processes because essentially patients vote with their feet. If they don't like the way something is going with their community or within their medical care, they will go to a different type of physician. And so we will often have folks who are patients who will leave one medical practice to go to another. The patients who feel very strongly about naturopathic medicine, where they've had some near miraculous events happen with the type of medicine that we provide, will often go to the legislature and speak very passionately about the need for naturopathic medicine in that particular state. And so the patients end up being very important in terms of the progress of some of these decisions made by lawmakers. And Jane, you'll have to help me if you would. I'd like to answer the second part of that question, and I'm not remembering it clearly. Could you please repeat it?
The trends of naturopathic medicine, yes.
So when you say trends of naturopathic medicine, I think, and I'm going to do my best to interpret what that means. I'm going to interpret it as the acceptance of naturopathic medicine within medicine overall. I would say that there is more and more integrative medicine that happens across the country. I think any of us can look at the marketing for our local hospitals, even our very prominent hospitals like Mayo and others, and see that there are what they would call alternative or integrative or complementary type practices that are offered to patients. And in some cases, these are what we might consider to be no-brainer type things. So hand massage before a patient goes into surgery, right? That's one end of the spectrum. Acupuncture may be offered. Nutritional counseling may be offered, those sorts of things, mind-body medicine. One of the things that naturopathic medicine brings to the table is what I call physician-level integration. Frankly, we're the only physicians who are trained not only in medicine. We can talk the talk. We know all of the diagnostic labs. We know all of the pathophysiology. We know all of the basic science that supports all of the diagnoses, and you can think medically and go through a differential diagnosis process and all of those things. And we are trained in our core curriculum, we are trained in many therapeutics that folks would consider to be complementary and alternative medicine. So the clinical nutrition and the mind-body medicine and the acupuncture and homeopathy, etc., go down that list of things. We are what I call bilingual. We can talk the medicine and we can talk the CAM. And by being able to do so, we can come to the table in an integrative setting and be able to speak medically with physician colleagues and be able to help those colleagues and patients understand what combination of treatments is best for the patient before us. Naturopathic medicine, I think, as you all know, is a very strong proponent of individualized care. And so we don't want to treat each patient who has diabetes the same way. There are certain themes that I think are very consistent in our treatment of all of those diabetic patients, and each of those patients is a unique individual, and we very much respect that and will support each of those unique patients in different ways based upon what they need at the time. And so when we're working in an integrative setting, we're able to bring that type of treatment to the table. We are experts in drug-herb, drug-nutrient interactions. And so while our pharmacists can very much be on top of drug-drug interactions, and if there are dietitians on staff at the hospital or in a practice, they will often be able to speak to drug-nutrient interactions. However, there are very few people trained in drug-herb interactions, and we are the only physician-level practitioners who are trained to do so and who can provide that type of information, which is a very important component of patient safety. We can bring that to the table. So I think in terms of the trends within naturopathic medicine, we have plenty of our graduates who are in private practice. We have a growing number of them in hospital settings, whether it be an inpatient, outpatient, or both types of care within those hospital systems. And we have more and more of our graduates also involved in research. Many of you are aware of the NIH. Within the under the umbrella of the NIH is NCAM. It's the National Center for Complementary and Alternative Medicine. And we have a number of our students and graduates participating in research through programs that are sponsored by NCAM. Also, National Cancer Institute, we have a number of folks who are funded through that organization as well. So there are multiple opportunities for our graduates in terms of successful careers, and all of this leads to what those trends might be within the medicine, how it's accepted, how we interact with other medical professionals, and how all of this plays out into successful lobbying, especially in regards to additional licensure throughout the country.
A good foundation. Can naturopathic doctors prescribe medicine if necessary, and do they operate?
Yes, naturopathic physicians have prescriptive authority. This, I do want to be very clear that this does vary state by state. So depending on what state you plan to practice in, it will be your responsibility to be very clear on what your scope of practice is within that state. In Arizona, we have a very broad scope of practice, so we do have prescriptive authority. I have a DEA number. Many of my colleagues do as well. And And so that speaks to the level of prescriptive authority that we have. So we can, in fact, prescribe pharmaceutical medicines. In the state of Arizona, we're not allowed to prescribe chemotherapy, as an example. So there are exclusions, but I think that it's somewhat understandable what those exclusions might be. In regards to operating, again, this will vary state by state, so be clear on your scope of practice. In Arizona, we have the authority to do what are called minor office procedures or minor surgery. And essentially what this means is we cannot open a body cavity. So when we're talking about minor surgery, we're talking about sewing up a laceration, perhaps doing, correcting an ingrowing toenail, removing a sebaceous cyst or a lipoma, doing lift and snips, those sorts of things. But we're not entering the body cavity to take out an appendix, as an example. That would be excluded from our scope of practice.
Okay, not the internal indeed. Can you tell us how well SCNM students are doing on board exams?
Sure. SCNM is very proud to be able to say that our students are doing very well on their board exams in regards to their clinical board exams, which are the ones you need to have in order to practice. We, over the, let's see, since 2009, we have been leading the other schools in regards to our board scores. In February of 2011, we had 100% of our students pass their clinical board exams. Typically, we are right around, let's see, if I were to do the math, the average going back to 2009 would be right around 88 to 90% of a passing rate for our clinical exams. As I say, we've been leading our sister schools, and we're very proud of that fact.
And then, once a student has successfully completed that board exam, does SCNM assist with job placements upon graduation?
SCNM was the first college to institute a career services program, and at this point we have a career services center. It's led by Joanna Hagen, who is very passionate about supporting student success as they graduate and go into practice. Through the Career Services Center, there are many opportunities for students to learn about business skills outside of what we teach within the curriculum. And Joanna is wonderful at working with students at the very beginning of their tenure with us and helping them to think from a business side of the brain to create business plans and those sorts of things to be successful upon graduation. And even those students, graduates who have been in practice, whether it's for a year or 10 years, she maintains an open door with them and provides services to our alumni as well. Many of our alumni will see come in and visit with her and get some additional support as they might need it. In regards to actual placement, Joanna does keep track of practices in our local area and practices of our alumni who are seeking new physicians to join them. She's also on top of any of the residency opportunities that are available for our students, etc. So she has a running list, if you will, so that students and even graduates, as they're making a move or as they're deciding what they're going to do, they can speak with her and she can help them make some very good decisions and then helps them get placed so that they know what they're doing as they graduate.
Thank you again. There are so few naturopathic accredited programs in North America. Do you collaborate with all the other colleges?
That's a really great question. I think that it would be somewhat obvious to believe that there's some competition among the colleges, and while that may be the case, especially as we talk about admissions, so to speak, there is probably more collaboration than I think many people might realize. Even on the admissions, within the admissions teams, there's collaboration in regards to what the prerequisites might be to gain entry into the colleges, the utilization of NDCAS, which is the centralized application system, etc. And we have a very strong collaborative effort among all of our chief academic and clinical officers among the colleges. There's a group of these folks who get together quite regularly by conference call and also face-to-face to ensure that each program is strong. And while there are themes, I think you will find across the board, there are many themes of similarity among all of the colleges. Each college does have a unique flavor, so to speak. I often will say to prospective students that it's all about the right fit. And what I mean by that is medical school being as challenging as it is, if you walk on campus to SCNM, let's say, and you say, wow, this really feels like the place for me, that sort of immediate attraction often is a deciding factor for students. So go visit the colleges, explore that, and look for that resonance, because that resonance will take this one layer of stress off of you as a student as you're going through the program. And as silly as it might sound, it ends up being a significant stress reduction, and students will speak to it sometimes very eloquently as I talk with them, or as you as a prospective student want to talk with one of our students, ask them about what it's like one college to the next. So we do each have our unique flavors, our unique communities, and at the same time there is collaboration among the colleges. We all have one programmatic accreditor, and that's really the place where you're going to see the consistent themes one college to the next. We each need to comply with the rules and regs, the standard of that programmatic accreditor. It's called the Council on Naturopathic Medical Education, and that's one of the places where we certainly collaborate.
I know the energy that you speak to, I felt it the day I walked on here, even as a staff member, for sure.
Yeah. Yeah, you know, Jane, that's really interesting that you say that, because so often when I, learn that there's a new employee who's just joined the college, I'll go over to say hello and welcome that person, and often that person will say to me how they felt such a unique energy on campus, and how they felt like they just wanted to be part of this community, and that was one of the decision-making factors for them. They felt like working here, they would want to come to work. And over time, it's interesting, as those employees are with us over time, they continue to speak to that. We recently had a summit on appreciative inquiry, and then a second on customer service, and a third on communication. These are examples of how the college comes together to really improve itself and have some self-reflection on what is it that we want to be. We like to make conscious decisions to drive our future, and we had opportunity in breakout sessions, to be able to talk with employees across the college. And I heard that over and over again, of how people just love working here, and how this community is so special to them. So it's not just students, it goes all the way through the organization, and I think that's really important and very unique.
I absolutely agree. Yeah. Speaking to the community, what's our experience with older, mature, senior age students? Without giving away too much information, can we disclose the oldest graduating student? Can you speak to that senior student?
Sure. I can speak to a little bit about the types of students who come to SCNM. The average age of students here at the college is 31. However, we have had students as young as 20. The oldest student that I'm aware of was in her middle 60s, if I'm remembering correctly. I'm not going to remember the exact age. So we do have a broad spectrum. We have students who are coming to us straight from undergrad, having gone through a pre-med program perhaps and felt very clear that they were called to be in the medical profession. We also have a very large percentage of students who come to us as a second or sometimes third career. And those students often come from a very wide range of backgrounds, and that's part of what makes our culture so interesting. We very much embrace that diversity of experiences and very much speak to a code of conduct that is respectful and inclusive. The majority of our students come from the southwest portion of the United States. We do have a high percentage of students who come from the East Coast, and then we have, let's see, the majority of our students, about 40% of our students come to us with a biology or a pre-med background. But for those of you who don't have that type of a background, I wouldn't want you to be scared away. We have students who are music majors, liberal arts, business, that type of thing, comprising probably, it's a minority of our student body, but I would say as much as 15 to 20% of our student body. And then we do have about the same amount of students who, percentage-wise, who are coming to us from a behavioral health, a psych background, that type of thing. In regards to the demographics, about 65% of our students are white, non-Hispanic, and we have about equal portions of Asian Pacific Islanders and African Americans, and just less than that of folks of Hispanic origin. And so again, we are one of the more diverse communities among our sister schools, and very much embrace that. We have a number of initiatives across campus where we are working to make sure that everything that we do is based upon some tenets that our diversity committee has put forward to the community. When I say community, I mean our SCNM community. So our hiring practices are very inclusive, et cetera. It goes through the entire organization. One of the other things I should mention as I'm thinking back to the question in terms of a senior student, the college has a number of student support services available to students, to every student. And so some of these services are supportive of those who may be going through some difficult times with family, for instance, and so there's need for, let's say, counseling. We have a counselor on campus. Let's say there's a student who's struggling with a particular class or a particular content area. We have a tutoring center, we have a diagnostic skills lab, we have a clinical rotation that's designed for students who want to have more training that's more one-on-one. The college is very proud to say that in the clinical training our student to faculty ratio is 6:1 or better. In the didactic setting it's hanging right about 14:1 or better, and so this is something that we're very proud of, the ability to provide students some guidance and mentorship from faculty, and then in addition providing support services for different types of learners and learners of varying ages. We have quite a bit of technology on campus, and everything on campus is wireless. All of the course materials are loaded into our ERP system that you would see called My SCNM. Some of you may already be interacting, utilizing My SCNM. Clinical cases are posted, so it's not just the didactic course notes, it goes all the way through the medical education. So we have all of these things in place to support the student's success regardless of the age, regardless of the background.
That's fantastic that we're able to support all the way through, definitely. This hour went very quickly. I do have several more questions on the board. I'm going to just try to choose one more here to go through. Actually, Dr. Girard, do our students see patients in other countries?
Oh, sure. Thank you for mentioning that. I can't believe I forgot to mention it. Within the context of flexibility within the curriculum, not only do we have the selective courses and the community clinics, students have the opportunity to do what we call elective site rotations, and that means that they can be here in Arizona in a practice perhaps that they discovered through the field observation program, and or if a student is, let's say, from another state and wants to go back to their home state and explore some practice opportunities, and doing so they can incorporate that into their curriculum here, so they could get credit for an elective site rotation in their home state or their home country. We've had students who have gone to India, Canada, Mexico, South Africa, gosh, just sort of all over the world, Korea, to do clinical rotations, and they get credit for that. There's some paperwork that needs to be done. There's always some paperwork, and there are some requirements around that in terms of the credentials of the physician and that type of thing that we must do because we're an accredited program. We need to make sure those I's are dotted, but that paperwork or those credentials are not onerous. They're pretty straightforward. In addition to these sorts of elective site rotations, our students are very active internationally in terms of providing care in other countries. We have somewhat regular trips down to Mexico where students provide care to folks who would not otherwise receive care. We've also had students who have gone to Nicaragua to do the same, and we've had students who have participated in medical mission work in Cambodia, Haiti, Sri Lanka, and Nigeria. This type of opportunity of medical mission work has a history at the college that goes back to the early 2000s. The college, for those of you who are, who read the vision and mission statement, part of our mission statement states that we are dedicated to the ideal that everyone deserves high quality health care. That statement is something that our students and our faculty take very, very seriously.
Thank you. Thank you again very much for all of this information today. I do want to quickly jump into the specific admissions requirements at this time. I do also see that I have several questions on the board that we have not had a chance to respond to quite yet today, and I will be certain to address those as soon as we are finished up here. I will email each of you specifically with specific responses. So let me quickly switch over to our specific admissions requirements. As Dr. Girard mentioned earlier, we do now accept our application through the centralized application system online through MDCAS. There's a web link here that requires 3 letters of recommendation are submitted with your application. There is, of course, an essay component. We do require all official transcripts from all colleges attended, even if there were 1 or 2 courses that you might have attended that you don't feel apply specifically to the prerequisites. We're still going to require all colleges, all transcripts be submitted. Of course, a minimum of a 4-year bachelor's degree. Then we require the specifics of this prerequisite coursework identified here. 12 semester credits of biology with labs for science majors, 8 semester credits of chemistry with labs for science majors, 4 credits of organic chemistry with labs for science majors, and then 6 credits of humanities, 6 credits of psychology, and 6 credits of English. I also want to provide you with my contact information. There we go. Again, in just a moment when I wrap up the webinar, I will address any of the questions on the board that weren't spoken to during the presentation. I'll be happy to email you all directly. But as you can see, there's my email address, j.voorhees@scnm.edu. I will definitely be happy to answer additional questions that you thought of after this seminar or after the webinar. And on behalf of SCNM, I would like to thank each of you for attending this webinar today. We do hope it's been informative as well as interesting. Thank you for your attendance today, and this concludes our webinar.